My name is Simon Miles and I'm a clinical dental technician. But what is a clinical dental technician? And what is it that I do differently to dentists and regular dental technicians? A general dentist covers a wide range of general treatments, including the provision of dentures. However, it is very rare for a dentist to actually make dentures. Yes, they do provide some of the work that goes into creating a denture, but the physical construction of the denture itself is made in the laboratory by dental technicians. A clinical dental technician's role is just making dentures. There are some other removable appliances, but it's mainly dentures. And we certainly don't do any general dentistry like fillings and extractions, etc. Because of a clinical dental technician's knowledge and skill set in making dentures, it means we can usually produce a better quality denture. The obvious problems that can arise from misunderstanding due to communication problems between the dentist and the technician. And this simply cannot happen when the responsibility of producing the denture rests on one person, the clinical dental technician. Now, there are exceptions to this rule, like when a clinical dental technician sends his work away to a different laboratory, like a dentist does. But even then, there is less likely to be any problems because the clinical dental technician can rectify potential problems before they become a real problem. I'll give you an example. One of the most crucial stages in making a denture is the trying stage. This is when the patient comes to see the clinician, whether that's a CDT or a dentist, and a mock-up of that denture is in a wax base plate with the actual teeth that are to be used in situ. It is placed in the patient's mouth and checked to make sure that everything is correct. We check the colour of the teeth, the shade of the teeth, position of the teeth, how high or low the teeth are, how forward or set back they are, the angle of the teeth, the size of the teeth, and a really tricky one, the balance of the teeth. And it's the balance of the teeth that will determine how the denture functions when you eat. Now, as a clinical dental technician, I can see most of these things within seconds of looking. With my experience and understanding of how the teeth are placed, I can usually see any problems immediately. Sometimes it may take me a few minutes to figure out what's wrong, but generally I can see it straight away. And this is nearly always the placement of the teeth. And for me, as somebody who has spent over 30 years of my life setting teeth, and because I have the tools required, it is easy for me to make these adjustments right there while you're still in the chair. Some dentists can do this and do it very well, but many find it difficult and some find it impossible. And in this situation, the only option for the dentist is to write down on the lab sheet what they want the dental technician to do. A technician that can't see you and has never met you has to rely on these notes from the dentist to explain what it is that he needs done. I'm sure most people can appreciate how difficult it is for a dentist and the technician in this sort of situation. I'm not laying the blame here, I'm just pointing out that the system is fraught with problems and that can often lead to the production of a poor quality denture, even with a highly skilled dentist and highly skilled dental technician. I'd also like to point out that mistakes can still happen. Making dentures, its very nature, is a really difficult task, and sometimes things can go wrong. It happens. And one of the things that can happen when things go wrong is that the patient gets caught in the middle of the blame game. When a CDT makes a denture, he assumes all responsibility for it. There is no, oh, the technician didn't do what I asked him to do, or, oh, the dentist didn't take a good enough impression. It's one person assuming full responsibility. Now, I am generalising, and there are some really good dentist, dental technician teams out there, especially where they work close to each other and have a very good working relationship. And that doesn't tend to happen so much with NHS dentures that are mostly manufactured in the big labs. And the dentures may be going to different technicians for each stage. The dentists here at the Smile Centre also make dentures, but they have the luxury of working directly with the dental technicians and me, which is a massive help, especially for those complex treatments where you need both technician and dentist, like with the implant removable dentures. So I urge you, if you need a new denture, seek out a clinical dental technician, preferably one that works closely with a dentist to get the very best possible denture.